Hi, everyone. Welcome to Sonata Insights Live. I'm Tara Murphy, Senior Director of Global Marketing and Advocacy at Gynesonics. Sonata Insights Live is a program that we launched to spark conversation about fibroids, the symptoms of fibroids, and treatment options. During these episodes, you get to hear from guests, physicians, patients, and advocates as they share stories and educate our audience about their experience. I'm really excited today to have a patient with us to share their story. And I have TaPre'shia Norris with me. Hi, TaPre'shia.
Hi, Tara.
Nice to see you as always.
Nice to see you too.
Let me tell everyone a little bit about you first, and then we'll start talking about your patient journey.
Okay.
So TaPre'shia is 35 years old. She's been working in the medical field for over 10 years and also has a son who is the age of 10 in 5th grade. In her free time, she enjoys baking and trying new recipes and is a big foodie who loves listening to music. That sounds great. All great things. Very nice. So let's talk about you and your fibroid journey. We're going to talk about everything step by step. So we want to just make sure that what we're doing is sharing with women what your journey was so that they could understand, what other women are experiencing and maybe think is normal, that's not normal, or understand that they're not alone out there suffering from fibroids. When did you first have fibroid symptoms?
I would say I was around 10 or 11. I started having symptoms of fibroids. But not a lot of people talk about it, so they were just saying it was menstrual cycles.
Oh, wow. And what were the symptoms that you were having at that age?
I was having heavy bleeding, heavy cramping. I had to use like the super pads, the very long ones, and sometimes I couldn't even go into school.
And how old were you when you started your menstrual cycle?
I was 9.
9. So a few years after you started, it started to get worse and you started to have these symptoms.
Yep.
Wow. And from that age, how did you start to realize and figure out that you had fibroids?
Just keep going to the doctors, explaining them my symptoms. They always will just keep putting me on different type of birth controls, and I just didn't feel like it was right at the time. But like I said, it wasn't anything that really people talked about that often.
Yeah, I mean, a lot of times we hear that the first treatment option that women hear about is medical management to kind of manage
Mm-hmm.
things. Um, and so that was kind of what your experience had been when you were suffering. Did you have a lot of times you'll hear about, women in your family or women will say, as I look back, we never talked about it because for us as women, I think it's a taboo topic. We don't really talk about
Mm-hmm.
our menstrual cycles. We're not talking about the suffering that we're experiencing
Mm-hmm.
when women have fibroids. So a lot of times we kind of are just silently suffering and assuming that what we're experiencing is normal and oh, this is just kind of what comes with being a woman.
Mm-hmm.
Do you remember looking back now and thinking, yeah, I recall seeing other women in my family that were having symptoms that may not have noticed at that point?
My mom, when I was younger, she had to eventually have to have a hysterectomy because she had too much going on, and her uterus actually fell out. But when she started figuring out like what was going on with me, she was like, now that I think about it, I think that was what's going on with me when I was younger too.
Wow. How old was she when she had a hysterectomy?
She was in her 30s.
Oh, that's really young,
Mm-hmm.
really young. So how old were you when they said, okay, you have fibroids, we hear you, it's not just something that's associated with you having a period?
Actually, it started like last year when they said, "Hey, it's fibroids and not your periods."
So for about 20 years, you were going on and using your voice and saying, something is not right. Something is not right.
Mm-hmm.
It took that long
Mm-hmm.
to get
Yeah,
this. Wow.
yeah. Yep.
What motivated you to keep looking? Because I think a lot of women would say, you know what, I guess this is what it is. I'm going to trust what I'm being told and just take medical management.
I was tired of being in pain every month, and I would literally carry around a backpack with extra clothes and stuff in it because my bleeding was so heavy. And I really didn't have a life either. I always would stay at home or I would go to work because it got to that point. And I'm like, enough's enough. I have a 10-year-old. I need to be active in his life too. And sitting around being in pain and bleeding is not going to fix the issue. So I had to get out there and meet with doctors and figure out what could be done.
Wow. So carrying around clothes, pain, bleeding through your clothes. Did you have any other
Mm.
symptoms that were starting to signal to you that you had something wrong?
The one symptom that I really had was when I was at work one day, and it was towards the end of the day, and I just had extreme cramping. The best way I can explain it was it felt like I was in labor, and I was like, oh, something is not right here. So that's when I called the doctor, and I was like, I don't know what's going on, but I need to be seen like right now.
And how long were your menstrual cycles normally? Like, were they a few days, a few weeks?
They were 5 to 7 days, but like I said, they were extremely heavy. It was a lot of bleeding and a lot of clots.
You know, our nurse advocate, Teresa, she and I were talking earlier today, and she was saying to me that a normal cycle is around 3 tablespoons of blood. And
Wow.
even working in this industry, and we had some coworkers that we were all on the call, and we were just talking about how that's something that really isn't known. And you think that if you're changing clothes and doing all these things, that that's normal. And we have so many women that are suffering.
Mm-hmm.
So yeah, that's a long time. And so having your son, you said it's time. I need to really push this even further and get something done. So
Yep.
how many doctors did you have to see, do you think, before you found someone that actually would hear you?
I seen a total of three.
Okay. And how did you end up learning about Sonata?
Um, I've heard about it from the first doctor that I seen,
Okay.
but at the time it wasn't an option for me because of my insurance that I had. So then I had to see other doctors, and of course, the main thing they like to say is get a hysterectomy, and that wasn't a route that I wanted to go down. Um, so I had to keep exploring other options, but then thankfully I got different insurance, so I was able to do the Sonata.
Oh, that's good. Yeah, I think that it's really important for women to be able to use their voice when they're in doctor's appointments. I think it's very intimidating when you go in and a physician says, "Well, this is what you need to do, and
Mm-hmm.
this is what's going to happen. And you're going to get a hysterectomy." How did you have the confidence as a patient to say, I'm not going to do that quite yet. I want to keep exploring my options. What made you strong enough to be able to do that?
Because I knew what I wanted for myself. And I wasn't going to let a doctor pressure me into doing something because that's what they had made up in their mind that I should have done. It wasn't the route that I wanted. So I had to use my voice because I didn't want a hysterectomy. It's not for everybody.
Mhm. Yeah, we always say there's every fibroid has a different type of treatment. Every
Mm-hmm.
different, every symptom is different, and finding those physicians that will talk to you about all of your treatment options is really important, and understanding what you want as a patient to be your goals, of having that treatment. So I think that's great that you were able to continue to do that, and that's why it's so important for you to be here today and empowering women to understand, that there are ways to go out there and to be strong, to make sure that you are knowledgeable about all of your treatment options that are out there. So
Yeah.
thank you for doing this today. So we're talking about Sonata. When you first heard about Sonata, how was it described to you? Do you remember?
Yes. So I was told that they go inside of your cervix and up into your uterus, and it kind of looks like a wand, and it has probes that come out of it, and it goes into the fibroid, and it sends electrodes to it to shrink it down. Um, but I was kind of like, is it really gonna work? Because I've never heard of anything like this before. Normally you just hear like they'll go in and take them out. So I did a lot of research on it, and then actually you guys came to my office that I used to work at and was learning more about it too.
Good. Yeah, that's funny. I was going to ask you if you had any concerns when you first heard about it, of like anything that made you a little bit skeptical, or things that you were worried about when you first heard about Sonata.
Yeah, it's different, but it's all about doing your research, hearing other people's stories. Um, at first, I'm not gonna lie, I was on the phone with the doctor the night before, and I was like, I'm scared that this is not gonna work for me. I really was gonna be like, forget it, I don't want to do it, just do the hysterectomy, because I didn't think that it would work
Mhm.
because of the amount of fibroids that I had.
How many fibroids do you have? Do you remember the size and the number of fibroids that you had?
I don't remember the number. I just remember them telling me that I had clusters of them.
Okay.
And they were pretty decent size.
Okay. And let's talk a little bit about your day of procedure. So when you talked to the doctor, they eased your fear a little bit of coming in the next day, and with Sonata, it's not going to prevent other procedures from being
Mm-hmm.
done in the future, um, as some other procedures do. Um,
Mm-hmm.
but what else did they say to you that made you comfortable to go in the next day to get the procedure?
Being minimal invasive. That's my biggest thing. Being out of work for a long period of time, not being able to function, being able to be a parent. That was the biggest thing for me. The
Yeah.
downtime. Um, and it wasn't that painful either. It was same day, so you went in, went home the same day. It wasn't anything overnight, which was another plus that I liked too.
Good. So you went in. Do you remember how long your procedure was, or how long you were at the doctor's office that day?
I want to say I went in around 9 and I got out around 5. But again, that was just because I had the amount of cluster of fibroids that I had. So mine took a little bit longer.
Yep. And were you under anesthesia? So you had to wake up from the anesthesia and things.
Mm-hmm. Yep. Yep. They put you to sleep.
But still, the length of a work day. You go in, have your procedure,
Mm-hmm.
go home that evening. Um, what was it like after you had Sonata? Do you remember, like, that night or the next day, how you were feeling?
Yeah. I actually felt fine. I had a little bit of cramping. I took some Tylenol and it helped. The next day, I went back to my normal life.
Wow. And so next day you were feeling good. The following week you were feeling good.
Mm-hmm.
And how long ago did you have Sonata at this point?
I had it last April.
Okay. And how are you feeling today?
I feel
Yes.
great.
Symptoms
Mm-hmm.
reduced?
Yep. Um, no cramping, not long periods, not a lot of heavy bleeding, not a lot of clots. Don't have to carry around the backpack anymore with extra clothes. So that's a plus.
Absolutely. How long after you had Sonata did you notice your symptoms starting to go away or reduce?
When I had my first menstrual cycle, it took about a month and a half for it to come in. And then when it finally came, honestly, I didn't even know that it was even happening. That's how
Wow.
my symptoms reduced. I didn't even know it was happening.
Wow. And it was significantly lighter than when you had your cycles.
Oh, yeah. Oh, yeah.
Very nice. And did your doctor have like a follow-up appointment with you, or was it just you?
Hmm.
Okay. And what did you do?
Yep. So they like to do an ultrasound a year after your procedure. But I was a little bit impatient, so I did 6 months because I wanted to see how everything's going. So we did that, and they have shrinked tremendously since my procedure. I have not did my year ultrasound yet. I'm gonna be due for that soon, but yeah, so you go in like a year later. But you have to go in. I think it was 2 weeks or 3 weeks after the procedure for like a post-op.
Okay. So you went in 2 or 3 weeks after, got checked out, made sure everything was fine after the procedure. You're now 8 months after, already
Mm-hmm.
a significant reduction in what your symptoms have been. And then you'll go back in April in 4 more months to see what your 1 year results are.
Yep.
Awesome. And you started to talk about it a little bit, but let's talk about, since you've had Sonata, how has your life changed? What activities are you able to do now that you weren't able to do before? Or what kind of experiences are you having that you weren't able to enjoy in the past?
For one, like I said, leave the house without a
Yeah.
backpack. That's one thing.
Mm-hmm.
Um, but I could be active with my son, go out with my friends, um, work out if I want to, not have to worry about the bleeding through the clothes or anything. It's I went back to like my normal life. Before I was home. I remember the one time that I had went out, it was to the grocery store, and I'm checking out, getting my groceries, and all of a sudden I just start pouring out blood right in the checkout
Mm.
lane.
And that's embarrassing, to say the least.
Yeah, that was very embarrassing.
And what has your son noticed since you've had the procedure? Has he said anything, just that he notices like a change in your behavior or activities that you do together?
Yeah. He says that I'm more happier, and he likes that I feel a lot better.
Good. That's awesome. I think kids are very perceptive, so they know when there's things
Yeah.
going on with their parent, or if they're
Yeah.
enjoying life, or if they're struggling, or suffering like that.
Yeah.
So that's nice. So if we're on here to educate women, to talk about using your voice to make sure that you're doing your research to understand what all of your treatment options are. What would you say to women that are suffering from fibroids to start? Like let's start there. What would you say to a woman who is suffering from fibroids?
Don't feel like you're alone. Um, do some research, see if there's treatments out there like this so you can be able to watch lives and interact with people. Um, and it's okay for you to see multiple doctors if you're not getting the answers that you're looking for. Because at the end of the day, it's your health. You're the one that has to go through it.
And what would you say to a woman who's considering Sonata as a treatment option based on your experience?
I would say talk to your doctor about it. And if you don't have a doctor that can do it, again, research and find a doctor that will. Um, you can always come to this Facebook page and reach out to people. You can always look me up and reach out to me. I'm always here to talk, to help with people. Um, but just reach out and use your voice.
Yes. So to your point, on our sonatatreatment.com website, we do have a physician locator on there. So if you are looking for a consultation, there are physicians who perform Sonata as well as other treatment options, so they can talk to women about that range of options. And again, you want to make sure that you're talking to someone so that you understand all of your options. Every fibroid is different. Every woman is different. The important thing is to find those physicians that will hear from you as a patient what your goals are in your patient journey and what treatment options you're interested in. So if you go to sonatatreatment.com, you can put in your zip code and find physicians in the area that you live in that are able to schedule a consultation with you to talk about Sonata and have a thyroid consultation. And also, thank you for volunteering your time to talk to patients, because I think it's really important if they do have an interest to speak to a woman who's been through it, who understands what they are suffering from, and want to hear about your experience firsthand. I think that's a great resource for them to actually reach out to you. So thank you for that. And we also do have a nurse advocate, Teresa, who you can find through our website, who can talk to you about treatment options and Sonata and help you to find a physician on that locator if you need assistance with that, as well as you mentioned insurance, which is such a huge component of care. these days. And luckily, since January, I think that probably was where your time changed. We got insurance coverage code, so we are covered by major insurance carriers as well as Medicaid in a lot of states at this point. But if patients and women need information on that, we do have an authorizations team in-house that can help to navigate that insurance hurdle or with you as well, so that they can help you to see if your coverage is carried. And then you can also check with your physician's office, and they'll be able to help to see what insurances are covered in their office as well. So thank you for bringing that up too. Anything else you want to say to women before we wrap up? And if anyone has questions, please feel free to put them in the chat. We're happy to have TaPre'shia answer any of those questions about her experience as a patient.
The only thing I just have to say is you guys are not alone. There's people out there with the same issues as you. It's not really talked about that often, but use your voice, and so you can get that help that you need.
Thank you. That is the most important thing. And thank you for using your voice today with us and with me on here. It's always great to talk to you. And what you're doing as a patient advocate is really important. So thank you for doing that. Oh,
No
I have a
problem.
question. Hold on, let's see. Oh, thank you for sharing your story, TaPre'shia, as a comment that we got in the chat.
No problem.
So thank you for that. And again, you can find a physician at sonatatreatment.com. Our next episode will be in the new year on January 14th at 3 p.m. Pacific, 6 p.m. Eastern. And thank you again, TaPre'shia, for sharing your voice and using your time to help empower other women the way that you've been empowered to help your fibroid journey. We appreciate you.
No problem. It's been a pleasure,
Thank
guys.
You. Thank you.